In this 58th video, I take up an important topic for discussion. You know, today the world is suffering with COVID-19, a very serious disease, and everybody is suffering with this disease. Most of the people are the victims of the disease, and sometimes it caused heavy loss to the people, humanity, and also the people involved in protecting the victims, and so all kinds of things have gone, and all kinds of things happened, and every human being is having threat perception with this kind of COVID-19, as it is causing very serious problem during the infection, and after the infection is cured also. Post infection problems also are very serious concern, because they are causing very serious health problems after the infection. They are called post COVID morbidities, we can say, post morbid infection problems, health problems caused by this virus, and even after the infection is alleviated, cured. That's why I call it as an important topic for our discussion. The topic is R value transmission dynamics of COVID-19. This is our topic. You know what is R value? It is nothing but reproductive number. What is this reproductive number? I will clarify later. Now, during this outbreak of COVID-19 pandemic in the recent past, huge data has been collected by doctors and the scientists on the transmission dynamics of the virus. So, the R value, the R factor also people say, R value or R factor, whatever it is nothing but a reproductive number of the cases, and that is why the scientists have collected very important data on this R value with respect to the COVID-19 pandemic in the recent past. It's almost 2 years have gone since the time of spread of the virus, COVID-19 virus, first in the Wuhan in China, and later it has spread to the entire world, all the nations, and it has become responsible for the suffering of the humanity, I can say. So, the COVID-19 virus was suspected. In fact, it was an unknown virus then to have spread in Wuhan in China in late December 2019. Officially, it was given the name SARS-CoV-2 by World Health Organization on 11th February 2020. In the beginning, it was thought that it is a kind of virus, maybe a SARS virus, but later it was realized by the researchers that it belonged to the same virus, but category of the virus is same, but with a different degree of infection, different degree of pathology, and a different degree of, I can say, prognosis of the disease, and I can say a different course of reactivity, different course of pathology, different course of infection. So, that's how it has led to the death of many people in many countries. So, at last, 11th February 2020, World Health Organization could name it as SARS-CoV-2. And the reproductive number, as I said, it's nothing but a reproductive factor which is concerned with the spread of the virus, the degree of spread of the viruses, and the COVID-19 virus, and the reproductive number or reproductive factor designated, or it is given notation or not, I can say. or not. That is the reproductive number R is given a designation or notation or not. So it is the number of new cases generated or reproduced from one case. This is a simple definition. What is R? The reproductive number or reproductive factor is nothing but the number of cases generated from one case. See the beauty? So this gives, R factor gives, the relatively the dynamics of spread of the virus, dynamics of transmission of the virus. Dynamics of transmission of the virus is given by this reproductive factor notation designated by R or not, the basic R value, basic reproductive number or not, or R, simply you can say R, capital R. Reproductive number gives an idea about the degree of severity of the infectious disease caused by a pathogen. It is a general definition. Any pathogen, when it infects the human race, then from one case and caused by this pathogen is going to give out, create or reproduce how many cases? From one case, how many cases, new cases are generated? That number of cases is given by the reproductive number, or we can say reproductive factor, denoted by R, designated by R. Okay. The researchers and doctors working worldwide found dynamic changes of R values in different situations with different control measures adopted by the governments in various countries. It's very evident that immediately after the spread of this virus in the world, all the nations, all the governments of all the nations have taken very strict measures, and they have observed, they have imposed very strict lockdown for several months. Say almost it is now 2 years, and for several months, all the nations in the world suffering with this COVID-19 spread have imposed very strict lockdown measures in their countries. Even Indian government also has imposed very strict lockdown measures in our country, due to which, of course, the reproductive number has gone down, has declined. That means showing that the spread of the virus, COVID-19 virus, has gone down, declined, and now how do we just say how the R value will imply the dynamics of transmission? See, the research and doctors working worldwide found dynamic changes of R values, and as I said, in different situations, different control measures adopted by the governments in various countries. Of course, the R value is higher than 1, then the virus transmission power will be very strong and higher, and if the R value is less than 1, means that disease will go soon, or it is declining, it is showing a decline in its spread. That means when the R value is higher than 1, then it shows the higher degree of spread of the disease, higher degree of transmission. This is the dynamics of transmission. When the R value is less than 1, it shows a decline in the spread of the virus, and it gives a positive hope for the people that yes, it will go soon, the disease will go soon, the virus will disappear very soon, because the R value, the reproductive number, the reproductive factor is less than 1, so therefore we can expect very soon the virus will go. This is the significant information that the R value will give to the people. The first case of COVID-19 was witnessed in India on 9th March 2020 in Jodhpur city, Rajasthan state. In the beginning, the R value was found to be 1.62, but slowly it has gone up. Then it increased gradually and has shown down in a higher value, but again it went back. It has gone down, and it has shown a downward trend. That is, very subsequently in many countries, of course, the R value in the beginning it was more than 1 and reached maximum value but slowly it has, say, we can say 2.08. Sometimes the R value was 2.08 in some countries. That means showing very higher rate of infection, and the infection was very fast and very high and infecting many people, larger proportion of the population, and causing really havoc, and the situation was very alarming, and people were very much worried. The governments were very much worried to control the disease, to eradicate the disease, bring down the disease back to normal, that is to a lower spread of the disease, lower the spread of the disease. They have taken so many control measures, imposing strict lockdown in their countries. Of course, though the R value reproductive factor was about 2.08 in the beginning, but due to the strict measures taken by the government, preventive measures, lockdown measures, slowly it has shown a decline. The R value came down to 1.16. In some countries, of course, 1.1, like that. So this is how the R value becomes very significant and important as far as the spread of the COVID-19 disease is concerned. So this is what we call transmission dynamics, and which is measured with this reproductive number R value. So therefore, this is an important topic to know the degree of spread of the disease or COVID-19 virus. So dear viewers, see the significance of the R, the value of R, reproductive number, reproductive factor. So dear viewers, if you like my video, share, subscribe and comment. Thank you very much, dear viewers.